If a woman can have a heart attack and not even know it, how do you know when to go to the emergency department to get checked out? I'm an ER doctor and I got a lot of questions about this in my last video, so I'm going to do my best to break this one down. First and foremost, you won't always know. If you have these symptoms and they're new, more severe than you've ever had, you should be seen. It's very easy for us to determine whether or not you've had a heart attack. Now that said, what's much more difficult is determining whether these symptoms could be heart related and not necessarily a heart attack itself. If you've been ruled out for a heart attack, it's important the next step, which means testing to determine whether you do or do not have underlying coronary artery disease. Now there are screening tests like treadmill stress tests, but there's tests that are even stronger than this, such as a cardiac CT angiography, which looks at your coronary vessels and can actually see whether there's narrowing or not. And if it's negative, you're good for about 5 years. You don't have to have any further cardiac testing to determine whether your symptoms are heart related or not. When it's all said and done, it could be anxiety, but anxiety is something called a diagnosis of exclusion, which means you've already tested for and ruled out the other causes.